Hi, my name is Sylvia Fogel. I'm a psychiatrist at the Lurie Center for Autism at the Massachusetts General Hospital, and I'm an instructor at Harvard Medical School. And I'm so happy to be speaking with you today. I have a specialty in treating the parents of children and adults with autism and other developmental disabilities. And while I don't have direct experience with Myhre Syndrome, I think many of the clinical situations and challenges that the population of parents that I work with encounter in their lives will very likely apply to you. And again, I'm so pleased to have this opportunity to speak with you. So all of us are balancing multiple demands in our lives, extended family, work demands, financial pressures, the regular stresses of day-to-day life. But when one has a special needs child, one is also dealing with complex medical issues, behavioral challenges, intense caregiving demands depending on the level of independence of the child or adult, and also a lot of uncertainty, which I'll get back to in a moment. So all of these demands lead to stress. And I'm going to talk a lot about stress today. And I think a lot of us think about stress in our daily lives, but I don't think many of us appreciate the physiologic impact of chronic daily stress. And chronic caregiving of people who are disabled, medically fragile, or very ill is one of the best studied kinds of stress. And we have a lot of data about that. So the stress response, the body's stress response, begins in the hypothalamus. And the hypothalamus can be activated by physical stress, so pain or illness, environmental stress, so traumas or uncertainty in the daily life, and also psychological stress. So that would include our responses to stressors or challenges in our lives. What's interesting about the hypothalamus is that it's directly connected to the part of the brain called the limbic system. And the limbic system is an older part of the brain located kind of on the sides here, deep inside. And the limbic system generates and processes emotion. So the hypothalamus, which is the first part of our sort of stress response in our brains and bodies, links to the limbic system. And I like to think about it as sort of kind of a translator of what's happening for us emotionally into then what happens to us physiologically. So the hypothalamus then kind of controls the pituitary gland. The pituitary gland controls the adrenal glands, and the adrenal glands produce stress hormones in our periphery. So cortisol, but also epinephrine, norepinephrine. And ideally, there's a feedback loop so that when cortisol is very high, the hypothalamus kind of shuts off. The hypothalamus also regulates other things such as body temperature, hunger, fatigue, sleep, circadian rhythm, immune functioning. So we begin to see how the hypothalamus's direct connection to the limbic system starts to impact lots of physiologic functions in the body. All stress isn't bad. When you have acute stress or short-term stress, it can actually be helpful. It can make you feel sharper. It can improve brain performance, attention. If it's not too intense, it can even temporarily improve immune functioning. But the problem is when the stress is unrelenting, and if the stress response can't be turned off or turned down. And that is a situation, again, that often occurs in chronic caregiving stress. So what happens? We learned about that hypothalamic pituitary axis, adrenal axis on the prior slide. So daily stress leads to chronic elevations in the stress hormone cortisol. When cortisol is constantly high, it can lead to a state called glucocorticoid resistance. So a lot of the cells, or almost all of the cells on the body, have receptors for cortisol. And in states where the body is constantly flooded with cortisol, those receptors become less sensitive to the cortisol that's already kind of floating around. One of the reasons that's a problem is because these receptors for cortisol also occur on immune cells. And when things are functioning properly, cortisol acts to modulate or downregulate immune functioning and inflammation. But when those glucocorticoid receptors become less sensitive, when you develop resistance, cortisol can no longer effectively modulate immune functioning, and you can get higher levels of inflammation and immune responsivity. Inflammation then can damage end organs. It can negatively impact the brain, joints, other organ systems. And when you have chronic stress, over time, the adrenal gland itself stops producing as much cortisol. It's as if the adrenals become sluggish. And this kind of further compounds the problem. And chronic stress and chronically elevated cortisol increases the risk of depression, cardiovascular disease, diabetes, autoimmune diseases, respiratory infections, and it increases the risk of mortality. I think there are unique challenges to living with a family member with Myhre syndrome that contribute to elevated parental distress and stress and chronically elevated cortisol. So I think, and this is not in any particular order, but one of the items that I think many parents in the special needs community struggle with is uncertainty. Uncertainty regarding medical symptoms or medical diagnoses that may be difficult to treat or kind of vague or poorly defined. Uncertainty about the future, what level of independence their children are going to be able to achieve. Uncertainty about what might happen when you go to the grocery store or a family gathering. Many of our children have difficulty in certain kinds of social situations that can lead to behavioral disruptions, behavioral distress. So there's just kind of constant uncertainty. I think in the case of Myhre syndrome, there's also a lack of knowledge in the medical system and in the community, which can further exacerbate stress and parental challenge. Complex medical conditions can be more difficult to treat, not only because of the lack of knowledge in the medical system, but because some children might have challenging behaviors or communication deficits. And for those of you who have children with significant challenging behaviors, you appreciate that that impacts the social functioning of the entire family. It increases, as parents, our own ambivalence and guilt and potentially negative feelings about our children. And in more severe cases, it can even lead to feelings of threat or lack of safety. And for those of you who may have children who also have significant social disabilities, so who may have symptoms or presentation similar to, let's say, a child on the autism spectrum, the social disability itself, the difficulty with empathy or appreciating another person's perspective, really impacts the quality of the parent-child relationship itself. And I think that this is something that many parents don't necessarily think about, although they experience very often. And because these relationships can be sometimes less satisfying on a day-to-day basis, it can leave parents feeling depleted and bereft. So I'm going to focus some data on parents of children with autism spectrum disorders because we have more data about that, but it's very likely that what I'm saying would surely apply to anyone living with a family member with Myhre syndrome, again, depending on the level of functional limitation or disability. So Parents of children with autism have elevated levels of anxiety, depression, and distress. Depression rates are as high as 60 to 70% in some studies, and anxiety disorders as high as 50% in some samples. They have an increased incidence of physical disorders and pain, so anything from joint issues to diagnoses of fibromyalgia. And the caregiving of a family member with autism is associated with changes at the cellular level as well, including endothelial dysfunction, so the cells that line the inside of blood vessels and capillaries, problems with inflammation, and increased risk of cardiovascular disease. I promise this is going to get less depressing as we go on. Okay. So I'd like to talk about a study of mothers who, looking at 96 mothers of adolescents and adults with autism spectrum disorders who lived at home, who were cared for at home. These 96 mother sort of child pairs were compared to a sample of 230 mothers of co-residing adolescents and adult children as part of a large study conducted in 2010 called the National Survey of Midlife in the United States, or MIDUS. So a subset, these 96 mothers who had children, again, living at home with autism, were studied intensively over 8 days. They received surveys, they had an in-person interview on every one of those 8 days, and they also submitted lab work and saliva samples to measure cortisol. And there were some very interesting findings. So just in terms of the day-to-day issues, mothers of children with autism, again, adolescents or adults with autism, were 3 times more likely to experience at least one stressful event on any given day. They had twice as many days with multiple stressors. The caregiving demands to tend to their children were at least 2 hours more than neurotypical children. They were interrupted at work an average of 1 out of every 4 days, compared to 1 out of every 10 days with neurotypical children. They were 3 times as likely to report a stressful event on any given day, twice as likely to be tired. Some of you are probably thinking like, yeah, of course, this makes sense. And I think really importantly, and this gets back to our sort of the prior slides regarding cortisol, mothers of kids with autism had stress hormone patterns that were comparable or similar to combat soldiers and those with serious post-traumatic stress disorder. And the greater the child's behavior problems, the worse the mother's stress and hormone patterns were. So what that looked like is this. So cortisol patterns were, so this is the comparison group. This is the parents with autism, the dotted line. I'm not sure if you can see my mouse, but the dotted line with the triangles is the moms with autism. So you can see that cortisol upon awakening is lower, and then cortisol throughout the day remains lower than this comparison group. So this sort of suggests a state that I mentioned earlier, where the adrenal glands become sluggish and are not able to respond appropriately and not produce as much cortisol as is needed. But interestingly also, the cortisol levels did not rise in response to stress in the way that it should. So this chart shows actually only the 96 mothers who had co-residing adolescents or adults with autism. So this on the x-axis describes the number of behavioral issues experienced in any given day. The triangles and the dotted line represent aggressive or dangerous or self-injurious kinds of behavioral issues. And this other line represents sort of more normative behavioral issues, maybe being unable to complete a task or follow through with something, or maybe mild emotional disruption. But as you can see, what you would expect is that the moms who are experiencing these more aggressive, disruptive, potentially dangerous behavior issues would actually have higher levels of cortisol. The y-axis is the first morning cortisol level. But in fact, you see quite the opposite, that you see that the response is blunted. Yes, the cortisol does increase the more behavioral incidents there are per day, but we see when the behavioral incidents are actually, just moderately stressful instead of severely stressful, that you see a really more appropriate rise in first morning cortisol. These are the number of behavioral incidents in the previous day. So that's just sort of one study really, indicating that the caregiving stress really produces measurable changes in cortisol and cortisol patterning. This is another study published in 2017 in the journal Brain Behavior and Immunity. And it examined 31 mothers of children with autism spectrum disorder, comparing to 37 moms of neurotypical children. The moms were all healthy. The groups of mothers did not significantly differ in age, body mass index, race, or education. And the researchers looked at the relationship between stress and a kind of a stem cell in the body called circulating hematopoietic progenitor cells, or CPCs. Again, CPCs are a kind of, I would say, kind of a stem cell. And higher levels of CPCs are associated with improved health outcomes, and lower levels of CPCs correlate with atherosclerosis and predict cardiovascular events. So CPCs also modulate neuronal health, so axonal and white matter production. And what they found was, oops, sorry, excuse me, I just need to pull up my. So what you can see here is that the moms with autism spectrum disorder across the board had lower levels of total CPCs and then different CPC subsets. And this was clearly statistically significant compared to the moms with neurotypical children. And sort of getting back to the issue of sort of the impact of day-to-day behavior and functioning of the child, the researchers also measured the number of negative interactions between parent and child, and positive interactions between parent and child. And what they found was sort of a correlation between negative interactions and lower levels of CPCs, and positive interactions and higher levels of CPCs. There are many other kinds of studies like this. I wanted to just highlight two of them, these two, to make a point that chronic stress, not only impacts organ functioning, right? In this case, the functioning of the adrenal gland, but that also has impact on a cellular level with these sort of very important parts of our physiology. So now we get to move, I think, more towards the good news. This is not all bad. Yes, many of you are struggling with day-to-day challenges, uncertainty, like many parents in the autism community. And while we can't change the necessarily change the stressors that we have to respond to and the challenges that we have to respond to, we absolutely have the ability to mitigate the impact of physiologic stress. So you, in your day-to-day life, using simple tools, can modulate your stress hormones, decrease inflammation, which decreases the risk of disease. You can reverse chronic illness, and you can feel better, less panicked, more satisfied. So I think given the impact of long-term chronic caregiving stress on our physiology, I really view self-care in the special needs population as a necessity. It's just not optional. If you want to stay well, you need to mitigate the impact of the physiologic impact of chronic stressors. You deserve to be healthy. You deserve to feel well. You deserve to enjoy your life, not just create opportunities for joy, in your affected child or other children. And your needs are really important. So many of us get caught. I'm also, I should have said this earlier, I'm also the mother of a child with level 3 minimally verbal autism, who also has a lot of challenging medical issues. He just turned 13. So I think I'm going to say, use the word us. Many of us really tend to focus all of our efforts on our children. But at some point, and I've seen this time and time again with the parents that I work with, it backfires. Parents develop depression, anxiety, physical problems. And I think at some point, it's really important to consider the needs of the whole family system, including yourself, and begin to prioritize those. And sometimes that might even mean, one less therapy session a week, or you don't sign up for horseback riding, or you make time, for respite, even though it might impact, on other aspects of the family system. So how do we modulate stress and promote resiliency? So super easy, 5 principles. I guess they're easy in principle, but maybe sometimes difficult to incorporate, but we're going to go through them one by one. The first is sleep. So many of you have probably seen in the popular press, Americans are chronically sleep deprived. This is a sort of image from the Huffington Post a couple of years ago. So one night of sleep is associated, one night of poor sleep, and by that they mean less than 6 hours, is associated with difficulty modulating hunger and blood glucose. You're more likely to have an accident. You are more likely to catch a cold. You don't support brain tissue and brain regeneration, and you can be less focused. But over time, chronically decreased sleep, and by this they mean less than 6 hours of sleep per night, your stroke risk quadruples, your obesity risk increases, the risk of some cancers increases, the risk of diabetes goes up, in part because blood glucose regulation and modulation of hunger depend on adequate sleep. And your risk of death actually increases. So I know many of us are busy, sometimes after we've had a challenging day with our children, the evening feels like the only time to catch up, to maybe kind of wind down. But I think it's really important for us to kind of think about the patterns of our lives, especially with respect to those evening hours and getting to sleep. Here's another just image of the way sleep impacts health. Here we have sort of metabolic syndrome issues, heart disease, increased mortality, decreased immune functioning. So how do you shift your routine? I think with all of these principles, I really think about starting slowly and making small shifts in your routine that are doable. I will often work with parents to really just get to bed even 15 minutes earlier than normal. sometimes it works for parents to really give themselves a hard out, like by 9:30, all my devices are going to be gone and I'm going to be in bed by 10:15. One technique can also be to prepare for bed much earlier in the evening. So while you're getting, your kids settled for bed, maybe you brush your teeth alongside them or wash your face alongside them or get into your pajamas much earlier so that when you do get tired, you can go right to bed and you avoid a second wind. And for those of you who are night owls, a second wind is probably something that you look forward to at the end of the day. But a second wind is really the release of stress hormone. It's the release of cortisol, epinephrine, and norepinephrine in the evenings. That's what gives you your second wind. And those stress hormones then negatively impact sleep. So it's really kind of helpful to think about avoiding that second wind. Much like, a baby who gets overtired can't fall asleep as easily. It's the same principle. So, regular schedule, consistency. Another thing to think about is to have some exposure to sunlight earlier in the day and midday. That can help regulate circadian rhythm. So if you live in a climate or a place and you have access to sunlight, not everybody does, but if you do, it's important to try to get outside. Turning off screens at night, regular exercise during the day improves sleep quality, and cognitive behavioral therapy if there are issues with insomnia or dysfunctional thoughts around sleeping. So the next is exercise. So, if we could bottle exercise, I think humanity would probably be a lot better off. Unfortunately, we can't bottle it. You have to do it. But exercise is really kind of like an elixir of life. And I sometimes feel like if people really understood the plethora of data around the positive health impacts of exercise, we would all do it more. So exercise modulates stress hormones. It reduces inflammation. Even 20 minutes of modest intensity exercise produces a measurable decrease in inflammatory molecules in the blood. Exercise can lower risk of disease and also treats diseases that you already have. So like diabetes or metabolic syndrome, it improves blood glucose tolerance. It also prevents those things, lowers blood pressure, improves blood lipid profiles, reduces the risk of physical pain, especially back pain and certain cancers. And most importantly, well, not most importantly, but I think additionally, very important is that exercise improves brain health. So exercise, there's a lot of data that it prevents depression and anxiety. It can actually treat depression. And there are some studies that show that exercise has effect sizes as large as some traditional antidepressants. So exercise is a really good antidepressant for those with mild to moderate anxiety who are still functioning well. Anxiety, it can treat anxiety, improves cognitive functioning, and prevents dementia. So I'm just going to show you some of these slides. We're not going to go through all of these studies, but it's just, there are hundreds more of these, and I just kind of wanted to show a few. So exercise increases levels of something called brain-derived neurotrophic factor, which is a protein produced in the brain that helps to support survival of existing neurons, and also encourages growth and differentiation of new neurons and synapses. And this is really important because cortisol actually negatively impacts the hippocampus, which is a part of the brain, also in the limbic system, that is responsible for memory. So while cortisol kind of sort of decreases memory and even the size of the hippocampus, the size of the hippocampus, brain-derived neurotrophic factor really acts to support neurons and neuronal growth. Exercise increases GABA levels. GABA is an inhibitory neurotransmitter in the brain that helps modulate brain functioning so it doesn't kind of spin out of control. So if you're someone who tends to ruminate a lot or obsess a lot, increasing your GABA levels would be really important. And also there's a ton of data that exercise improves cognitive performance. And also treats and prevents depression and anxiety, as I mentioned before. So, your brain loves the gym. When you exercise, you produce norepinephrine, which improves attention, perception, motivation. We talked about brain-derived neurotrophic factor. And you release endorphins, which is helpful for mood and increase blood flow, and certain neurotransmitters, which can also enhance mood, focus, and learning. So this is one of those things that you just kind of have to make a priority within your life and your family, and there's no other way around that. And for some families, it really involves that some other things are going to go missing in the family system. Maybe one less ballet lesson or one less piano lesson, or figuring out creative ways of integrating regular childcare, which we'll get to in a moment. But it really does make it, need to be a priority. That said, it can be modest. 10 to 20 minutes most days of the week will get you a lot of the benefits. More is probably better, but 10 or 20 minutes of modest to moderate exercise, you're going to get a lot of the benefits that we talked about earlier. So start slowly, be modest. It doesn't need to be complicated, just a walk or a swim. One of the silver linings of the pandemic is that there are a lot more sort of online platforms where you can subscribe for a modest monthly fee and have access to all kinds of classes: yoga, boot camp, stretching. If you can integrate a social aspect, walking with a friend, that's kind of doubly better. I think the trick is to experiment, find things that you like, that you can sustain, and just go do it. And if all else fails, make 5 or 10 minutes to walk and get outside. And I know for myself, one of the things that's helpful in this sort of a cognitive technique is not only to picture how you're going to feel afterwards, but picturing the long-term arc of your life, the next 5 years, the next 10 years. Remind yourself that you want to be there for your family. You want to be not only alive, but also healthy and functional. Meditation and mindfulness. I'm going to speed up a little bit because I think I'm going sort of over time. So meditation and mindfulness are also incredibly powerful techniques. Meditation can also modulate stress and stress hormones. Meditation has been actually shown to decrease the transcription of DNA of pro-inflammatory compounds. So meditation, probably by impacting our autonomic nervous system, so our sympathetic and parasympathetic nervous system, actually has an impact on DNA transcription, at the level of the nucleus of the cell, which I find like completely amazing, and really speaks to the importance of sort of mind-body medicine and thinking in a systems-based, sort of whole body sort of way. So stress meditation reduces gene expression of pro-inflammatory compounds, reduces blood pressure. Meditation improves the connectivity in the brain, particularly with respect to the frontal connections between the frontal lobe and our limbic system. So our limbic system is sort of the older part of the brain, the more emotional part of the brain. That's where we sort of process fear-based emotions. But the frontal lobe can act to inhibit the limbic system. So if the frontal lobe limbic connections are strong, that inhibition or modulation can be improved. There's many different styles and types of meditation. You know, you need to experiment. One of my favorites is a woman named Tara Brach, and I meant to put in a slide of her website, and I'm sorry that I didn't do that. I forgot. But if you look her up, tarabrach.com, she's a clinical psychologist who also teaches mindfulness meditation from a Buddhist psychology perspective. And she's someone who dealt with a lot of her own health issues. And she teaches a lot about meditation, but also about the importance of self-compassion and positive regard to the self. You know, many of us are in our heads all day long, criticizing ourselves. We're telling ourselves things that we would never tell a spouse or partner or a friend. So she's an amazing kind of guide around awakening ourselves to our negative self-talk. Jack Kornfield is another wonderful meditation teacher and from a Buddhist psychological perspective, and Headspace and Buddhify are two well-known apps that are easy to download that can begin to sort of teach meditation. Again, start small, sometimes before bed or upon awakening are times that people feel like they can fit this in. And the most important thing to remember is that there's no right way to meditate, and meditation is not about sort of emptying your mind, not having thoughts. Meditation is really about sustained, focused attention and awareness to whatever is going on in the mind. So when people tell me, you know, I'm not good at it, I'm still with having all these thoughts, I'm not good at it, I think, great. How many times did you notice, you know, that you were thinking and you were able to bring your attention back to your breath or to a point that you were thinking about? I can't say enough about meditation. I think often, you know, following someone who's a very good teacher or taking some meditation classes is probably a good way to get started with that. Again, these are some data studies regarding meditation and mood and anxiety symptoms, inflammation. These are the apps that I mentioned. This one is called Buddhify. Insight Timer is one that's free. Insight Timer kind of takes many, many different meditation teachers from all over the world and kind of concentrates their videos or podcasts. It can be a little difficult to navigate if you're not sure what you're looking for, but it's also free, which is good. Headspace, Calm is another app that's gotten good reviews from my patients. And then social connection. So this is an article from the New York Times a couple of years ago. I think the title speaks for itself. All of you are dealing with a lot of challenges from day to day, but having a special needs child also, for many families that I work with, kind of limits the kinds of social interactions they can engage in, limits their sense of really who understands their experience. So getting together with people who are discussing, you know, more typical stressors can sometimes feel unsatisfying and isolating. But the bottom line is social connection improves health and well-being. And there's a lot of data around this. And it's part of what made the last year and lockdowns so difficult for many people, because social isolation has negative impacts on health. So this is just a little kind of image from a place called the Center for Compassion and Altruism Research and Education, called CCARE at Stanford. So low social connections leads to higher levels of inflammation at the cellular level, slower recovery, increased risk of anxiety and depression, and increased risk of suicide. And of course, these effects are bidirectional, right? Someone who might be anxious and depressed are more likely, you know, to become more socially isolated, but it's bidirectional. So it's important to keep in mind, but still I think these associations are very powerful. Conversely, social connection has a 50% increase in longevity. I mean, this isn't like an amazing finding, you know, and you get improved gene expression for immune factors, positive immune factors and anti-inflammatory factors, lower rates of depression and anxiety, better emotional regulation. So the bottom line is social connection is good for you. So I think at this point, many of you are thinking like, great, you know, how do I integrate all of these things? I don't have enough time in the day as it is right now. So here is where I think if you can make a commitment to yourself, that commitment will probably involve finding any way possible to get more caregiving support into your lives. For some people who have the financial means, I think that means investing in as much paid childcare as you can comfortably afford, and to not feel guilty about that. You know, we see the impact of chronic stress. You're living with challenges that the average family, you know, couldn't even dream of. So getting in, again, as much childcare as you can afford, and trying to turn off any kind of guilty feelings you have about that, and really just do it. For those people that can't afford paid childcare, I've had parents who have approached their places of worship or congregations and asked people to volunteer in their homes, and then trained those people, you know, to work, to learn to work with their children. Many students in high school and colleges need to do community service. Asking family members, you know, not everyone has extended family members. Some of us as family members, we'd rather see less rather than more. But I think if there's a way that, you know, if there are people available to you, to sort of not hesitate to ask. I think part of our, you know, culture in the United States, and as actually, I think some of you are international, but at least here in the United States, there's this sort of culture of independence and being sort of, you know, being seen as strong and independent. I think, you know, I think when parents can recognize that they need and deserve support, it makes it easier to ask others and to ask people on a regular basis, you know, to really sort of vulnerably say, I need support. Can you help me on a regular basis? And then another strategy is to sometimes use therapists to give yourself. So people who have in-home behavioral treatment or occupational therapy, to really make use of the time that your child is with another provider. Even if it, you know, even if you still have to be at home or in an office setting, how can you really make every moment count, not only to get things done, but to nurture yourself in these ways that we've talked about. So the final pillar is diet. And here again, you know, when you're balancing all those busy demands, you know, from that first slide with all of those Post-it notes, how do we make time to really eat well? But here again, you know, there's tons of emerging data for the importance of a whole food, low inflammatory diet. So 3 principles: eat real whole food, not processed, not packaged, you know, something that you make yourself. All of us could probably use to, you know, benefit from doubling our vegetable intake, you know, unless you're already really eating 6 or 7 servings per day. Adding healthy fats such as avocado, nuts, low mercury seafood, reducing as much as possible refined carbohydrates. So carbohydrates, the short of it is they fuel inflammation. Even whole wheat pasta, even whole wheat bread leads to a glucose spike in the blood, and then a subsequent insulin spike in the blood. Insulin, you know, is necessary for life, but high levels, chronically high levels of insulin have really negative impacts on the brain and the body, and lead to insulin resistance in much the same way that we reviewed with glucocorticoid resistance. So reducing refined carbohydrates, is really important. Think of whole grains as a side, and think nutrient density. How can you add nutrient density to each meal? These are a few of my favorite books. The first three really kind of just talk about the power of nutritional interventions to transform. Terry Walls is a family practice doctor who had severe progressive MS that she was actually able to reverse through very intensive dietary intervention. She now speaks and lectures widely about that protocol, which has helped other people. Mark Hyman is a kind of well-known integrative functional medicine doctor. David Perlmutter is a functional medicine neurologist who details the negative impacts of grains. And for those of you who might be overweight or obese, I think Jason Fung's book called The Obesity Code represents really, really important and cutting edge tools to correct insulin resistance, which then ultimately leads you to lose weight. So it's probably too much to go into right now, but those are some of my favorites. And thank you all for joining me today and for listening. And I want to give a special thank you to my son, Theo, who has been my greatest teacher. And I know many of you probably feel that way about your own children with special needs. So thank you.